This is how my day starts. We have cattle on 7 different places. This is one of them. Usually every other day I feed.
If you're out in rural Texas and you have an accident of some sort, you're going to want health care services there, or you're going to want a hospital. I've seen what happens in rural communities when the hospital closes. Without the hospital, without the emergency room, you have very bad outcomes.
Today, we are in pretty decent financial shape.
We're ready to start the meeting.
A year ago, basically we'd meet, decide whether we're going to try to keep the doors open or close the doors.
We have 16 to 17,000 individuals in our county. Probably a third of the population, 60 years of age or older. If we didn't have health care in our facility, those individuals would have to travel 30 miles to another center. That is unacceptable.
A woman pulls up here with a man sitting in here in a pickup, and this poor son of a gun was blue. Had our hospital not been here, that man would have died right then. They were 25 miles from any health facility. That's why we have to have a hospital. That's why we need a hospital.
I feel like it's going to be detrimental to communities that are further than 30 minutes. Do families want to be in communities that they don't have access to that type of health care? That's going to be a big question.
In rural communities, it's like a 3-legged stool.
Here we go.
You have the schools, you have industry, and you have health care. And on a 3-legged prong basis. And when you lose one of those, that's what tips it over. If we closed our hospital, not only would it have an effect in the immediate community, it would have an effect on the countywide basis.
This thing is not a failing situation. It's struggling. It's not in good shape, but it's not failing. If we don't take care of our finances, and if we do not think outside the box to create new revenue, if we do not have the people in Austin, Texas that set the rules and regulations, if we do not have their support and help, then we're in bad shape.
Mr. Matthews. Good afternoon. My name is Ted Matthews. I'm the Chief Executive Officer of a small rural hospital in Anson, Texas. Our state senator right now that falls within the district of Anson, Texas, he has 32 rural hospitals in his district. We have to have that same standard of care, the gold standard of care for our community that those in the metropolitan areas expect.
Thank you.
85% of Texas geographically is rural. And so yes, rural matters.